We have two campuses for our emergency departments, one in Kirkland and one in Redmond. Both of our facilities are really special places to be seen if you have an emergency. Some of the nicest features I think of both emergency departments are the fact that they have all private rooms, that there's not shared rooms, so you have your own private personal space for you and your family. They're quiet. It is not loud. It is not like you see on TV where everything is very chaotic. It is very calm when you come in, which really makes everybody feel just a lot more comfortable when they're being cared for. Some of the other things we looked at when we were building the emergency department were making sure that the staff was visible to the patients, that we could get people in and out of the emergency department quickly by having all the facilities and everything that we needed to care for people right in the ER itself, and not have to have people go all over the hospital to get the care they need.
The entrance for people that are coming in by their own car is totally separate from where the ambulances come in. So when you come into the emergency department, you come into our waiting room. You are greeted by the triage nurse, you come in, and then the triage nurse talks with you. We decide what your acuity level is, 1, 2, 3, 4, or 5. A 5 means the doctor probably needs to have a visit with you, can give you a prescription, and then you're on your way. A 1 means you're requiring immediate life-saving intervention to be able to support you. So we have 40 beds. 10 of them are in a non-emergent treatment area. Those are like sprains, lacerations, chronic migraines, sore throats, things like that. And then we have 30 beds for anything that could range from very laceration up to somebody that needs to be have some immediate life-saving interventions, whether it's CPR or intubation. 4 of those 30 rooms are big trauma rooms, so they're set up for a lot of people to be in. They're working on a patient should we need that.
We're able to move the walls in between the 2 bays such that you can make one very large bay if you need to. When EMS or the paramedics and aid cars arrive in our emergency department, they have a covered area where they can unload patients, which is not always the case. We quickly have an area that they can see where the patients are supposed to go to, in which room, and then subsequently they go directly into that room where they're greeted by a nurse and a physician when they get here. Other things are certain special situations where patients get exposed to certain chemicals or have some sort of other environmental exposure that require them to be decontaminated prior to coming into an ER so we don't expose more folks, and we built that into our design.
We can divert them to go over to the ambulance entrance, into the shower, and then straight into a patient room where they can get all of the access that they need to medical care, and they're cleaned off and rid of their contaminant before they even get into a room.
One of the things we really looked at was trying to be very lean with how we set things up. Essentially what the focus of that is to make sure everybody knows where everything is at in every room. So if you walk into room 3 versus if you walk into room 5, all the equipment, all the things are in the same spot, so you can be as efficient as you can be taking care of a patient. And when a patient's critically ill, you're not fumbling around trying to find out where something is at. When we designed this emergency department, really the credit goes to our staff who worked on putting this together. They did a lot of research, went to a lot of site tours to figure out what was the best model out there in the country to find a way to make this the best emergency department it could be.
It takes a team of people to deliver good care because there's so many components of somebody's life that you touch with medicine. There's so many things that go into it. You need the pharmacist to help the docs know about medications. You need techs to do EKGs and the nurses to get the IVs in, and you need your colleagues to help support you when there's something that happens that you didn't expect. And that's kind of what we're kind of on guard for all the time in the ED is what's the unexpected going to bring, and you got to know where your resources are.
I think one of the best things is that you can judge a place by is where would you want your family to go if they were to get sick, and who would you want to care for them. And I can truly say that if my friends get sick or my family gets sick, it makes me proud to know when they come to Evergreen because I know they're getting the best care possible.
The people that I work with, they pour their heart and soul into really wanting to take good care of patients, and you can't imagine doing this job with anybody else. We love being here for the patients.